Welcome to Health Matters. Your host, Dr. Colin Saldana, is here to discuss issues on many aspects of health. We're very fortunate to have with us Dr. Adam Mamalak, an assistant professor at the University of Ottawa, who's a dermatologist, a consultant dermatologist. You see, acne is one of those issues in teenage years, adolescent years that can leave scarring marks on your face and other parts of your body if they're not really adequately attended to. So to shed some light on this very important topic is Dr. Adam Mamalak. Dr. Mamalak, tell us, what is acne all about? When does it really start to occur? And perhaps more importantly, what are the causes of acne?
Absolutely. You know, it's so funny, Colin, you're doing a show today about adolescent issues, how to talk to your adolescent, how to talk to your teen, and how to understand your teen. Acne is one of the things that is most prevalent during adolescence. We see 95% of individuals will suffer from acne at some point in their lifetime, and the majority of these, it occurs during the teens. We know a lot about acne, we know a lot about what causes acne, but what we're beginning to understand is the actual impact that acne has on these individuals. I can tell you that people that suffer from acne don't date as much. They don't do as well in school. They don't participate in sports as much. There are actually even higher rates of unemployment in acne sufferers compared to those with clear skin.
Tremendous psychological impact.
The effects on the self-esteem, the effects on people's confidence are seen throughout. We see it in all aspects of life. So this is not just a condition. This is not just a disease that's part of growing up that goes away and then you never worry about it again. It does have long-lasting effects, which is why acne is considered a disease, not just something that happens.
So the patients come to me and says, you know, I'm having oily food, I'm having spicy food, that's why I've got this acne. Is there any truth to this stuff that diet plays a role in acne?
Well, I'll tell you, the causes of acne have been actually investigated quite significantly. And we do know the causes of acne. I actually have a slide showing this. We do know that excessive oily skin and excessive oil production in the skin can cause acne. Sticky skin cells, our skin sheds every day. The cells that don't shed off, that clog our pores, is also another cause. There's bacteria that gets into our oil glands that can precipitate acne, and hormones by far is one of the biggest causes of acne. We have the highest hormone fluxes during our teenage years, which is why we see the most acne during this time. You asked me questions about food. It's very interesting. There have been multiple studies looking at food and acne, and we all think that, oh, I had a soda, oh, I had a bag of chips, I'm going to break out tomorrow. Actually, the studies have shown that there's not a big correlation. So eating that greasy food might be bad for other reasons, but it won't necessarily make you break out.
So let's assume now, I'm a parent and I know that my teenage daughter's son is entering those teenage years, potential for acne. What can I do to minimize my chances of getting acne? You talked about the genetic hereditary component. So if I've got it, how can I prevent that from happening? What are some of the tips, things that I can do to ensure that that doesn't happen or minimize it?
Well, some of it is, you know, luck, as we say. Your dad had acne, so maybe you might get it. And certainly a family history, or if it is in the family, your children might be predisposed to getting it. But taking care of your skin on a regular basis, washing your face twice a day with a cleanser and with water to make sure the skin is not excessively greasy. Using makeup that's non-comedogenic. Non-comedogenic means non-acne forming. These are makeups that don't clog your pores, that won't predispose you to developing these lesions.
Just let me, so use a cleanser. Tell me something, when I go over to the pharmacy and I want to pick up a cleanser, what should I be looking for when I look at it? Just any cleanser? Should I be looking for something in particular? What?
In general, cleansers have different preparations.
Okay.
So one is finding one that agrees with you. Some cleansers are particularly harsh on the skin, can irritate your skin. Others are too mild and don't give you the effects that you want.
Soap and water?
Soap and water is a good way to start. If soap sometimes can be heavy and sticky and leave a film, so usually a mild cleanser. Sometimes they will contain products like salicylic acid and glycolic acid. These products break down the skin, open up the pores, treat those sticky skin cells that I was talking about, and take away some of the excessive oil in the skin.
So what about these? What about, you mentioned about makeup, non-comedogenic makeup. So what should I be looking, what should the ladies be looking for in the makeup?
It says right there on the label, non-comedogenic.
And that's That's what they
what
should be.
you want to look for.
So what about facials? You know, people say, I've got facials and open out these pores and
my personal philosophy is you want to be as gentle to the skin as possible. Okay. You know, they sell products particularly with beads in them, and they say they're exfoliating beads. Sometimes this can be very damaging to the skin.
The scrubs.
The scrubs, exactly. We see this often actually in individuals with olive skin tone or medium skin tone. They use these scrubs and they get dark marks that are left behind. They're traumatizing their skin to try to open up these pores, where actually you can go about this in a much more gentler type of way, taking care of what you're actually putting on your skin and actually how you're removing it. So using good makeup removers, gentle cleansers on the skin are probably enough. And without using heavy greasy makeups, in general, you'll be taking care of your skin quite well.
Would you tell the young ladies with acne to use makeup or not to use makeup, or to use makeup sparingly? What kind of advice would you give them with respect to makeup and acne?
I mean, makeup is, again, another personal issue, and depending on how much you like to use, that's kind of your choice. But there are makeups that are good. The mineral makeups in particular are the most least irritating for your skin. Mineral makeups also do tend to be a little bit more expensive, but in general you can use cover-ups pretty safely while protecting your skin and taking care of things.
Now let's go to some slides, because I think you've got some slides for us that really talks to the nature of the acne, the extent of the acne.
So when we talk about acne, there's actually different types of acne that we're talking about. So people will often differentiate between these, but you know, it really is a family of a disease. So the first type of acne is something we call comedones. These are the blackheads and the whiteheads that we see. And this is actually one of the manifestations. This happens when the pores are clogged. So those sticky cells that I was talking about don't let the oils out. The next step is a more inflammatory component. These are papules and pustules. When we see inflammation in the skin, we get these red bumps, and sometimes we get the pussy bumps as well. The pus is a sign that maybe that bacteria P. acnes that lives in all of our skin and lives in all of our pores is proliferating and getting to a level where it's causing inflammation in the skin.
So now coming back to the first slide, which we had the comedones,
yes,
which is the blackheads.
Yeah.
What's the best way of treating those?
So the best way of treating this is using a keratolytic agent. A keratolytic agent is something that breaks down the skin. Things like salicylic acid, glycolic acid, lactic acid, all of these increase skin turnover.
In the cleansers?
In the cleansers.
So simple cleansers,
yeah,
for the comedones should work.
Absolutely.
Okay.
And there are prescription medicines as well. The vitamin A-based medicines, the retinol, the retinoids, vitamin A acid, retin A, differin, all of these are a group of medications that will help increase skin turnover.
Perfect. So now we come to the papule component.
The papule component means more inflammation is there. So you want to use something that's anti-inflammatory. Topical antibiotics like erythromycin and clindamycin. Benzoyl peroxide products are very good anti-inflammatory. They're also antimicrobial, so they help treat that bacterial component. And the retinoids, again, have an anti-inflammatory effect.
And sometimes a combination of the two would work.
Absolutely.
You use the cleansers in the daytime, and you'd use the antibiotics by night, so your doctor would work that out. But you can use the combination.
You know, you touch on something else. Not everyone is the same. So there's not one magic bullet here. There's not one magic cream that's going to wipe away all of your acne. Sometimes you need to be more aggressive. Different people respond differently to what you prescribe. And it's really about individualizing the treatment, and your doctor or your dermatologist is the best person to help you out with that. The final type of acne, and the one that we always think about and sort of worry about, is those nodules and cysts. These are the deep ones underneath the skin. And this can actually predispose people to scarring. And the scarring is an issue because we do know that the acne eventually will resolve and go away, but the scarring can be lifelong. And that's something that when we see these patients in our clinic, we want to be very aggressive. These patients often need oral medications, antibiotic pills. They need some type of hormone regulation. Birth control pills. Birth control pills, many of them are actually approved as acne medications now.
Just very quickly, we have a caller waiting for us, but in terms of the extent of the disease state, could you just comment sometimes on the duration of the antibiotics? Because it's significantly a long period. Some people want to go just for a week and be done with it, but it's a much longer period.
Absolutely. I usually say it takes about 2 months to see the full effect of these medications. And a lot of people are hesitant about taking medicines for such a long period of time, but The actual safety profile of most of these antibiotics is very well known, and we are in the habit of using them for this period.
Thank you very much. We have a caller. Hello?
Yes?
You're on Health Matters. Could you identify yourself, please?
Oh, Kathleen from Mississauga.
Yes, Kathleen. Go ahead and ask a question to Dr. Mamalak on acne.
Okay, thank you for taking my call. I'm just wondering if you can address hyperpigmentation. I had a side effect from taking medication with what they've diagnosed as a pregnancy mask, and I have hyperpigmentation.
Okay, we'll go to the question very quickly because we don't have much time. It's not an acne, but go ahead.
Okay.
Hyperpigmentation, especially for what they call the mask of pregnancy or melasma, is a common thing. It's an interaction between female hormones and the sun. And often we'll see this in women. They develop dark patches under the eyes, sometimes on the forehead or on the chin, particularly when it comes out in pregnancy. We see it sometimes as well with other types of hormonal therapy, like when women are on birth control pills, is another common time that they take it. Interestingly enough, hyperpigmentation is something that can happen with acne as well, particularly again in those olive skin patients and those medium skin tone patients. The red bumps go away and they leave dark marks behind. There are treatments for this. There are bleaching creams that are available. You can also do certain types of resurfacing treatments like chemical peels. Certain laser treatments are very effective as well for treating this, but it is a stubborn problem. Probably the best thing that you could do is prevent it by wearing sunscreen every day, because the more sun you get, the more pigmentation you might get.
It's interesting you should mention about sunscreen. We're getting into the summer months. Just have a quick comment on sunscreens. What should our viewers be looking for when they're going out to buy a sunscreen?
Always try to look for a broad spectrum sunscreen, something that covers both UVA and UVB. Because we're talking about acne, there are multiple preparations out there. Some are better for the face, that are lighter, that won't clog your pores. Some are better for the body, that are a bit sturdier. But if you're going to be out...
Thank you very much, Dr. Mamalak. Sorry to cut you off because, you know, I think this is an exhausting topic. It's all about beauty and good looks for the teenagers, and I think it's all about building self-esteem. Ladies and gentlemen, thank you very much, and you've been watching Health Matters. Good night and enjoy the rest of the week.